My name is Clint Thurgood. I'm a licensed clinical social worker at McKay-Dee Hospital. I work in the emergency department as a crisis worker and also in the adult behavioral health unit as an inpatient therapist. One of the common questions we receive is, what do I do in the event of a crisis? Well, the purpose of the crisis worker at McKay-Dee Hospital is to assess someone's risk to themselves, their ability to maintain safety, but also help them find the appropriate resources, whether that be an inpatient admission or an outpatient appointment or something in between. The crisis department is staffed 24 hours a day, 365 days a year. We often receive phone calls from people who have questions about their loved ones, about warning signs that they could be looking out for. 3 common warning signs might be isolation, crying, and also not taking pleasure in activities that they normally enjoy doing. The priority of the crisis worker is to ensure the safety of the patient and others. If a patient cannot be safe, then we speak with them about the appropriateness of admitting them to the hospital. When a person comes to the emergency department to speak with a crisis worker, there are really 2 possible outcomes. The first would be admission to the hospital. The second would be to go home with a plan to engage in medication management, therapy, substance abuse treatment. If you're admitted to the hospital, a typical stay is 3 to 5 days. During that time, you would meet with a psychiatrist, a nurse practitioner, clinical social workers, recreational therapists, nursing staff on a daily basis. One of the most important things that we try to include in a patient stay is to really involve family care. Although you may be the patient who is in the hospital, at home there's more than likely family who also needs support. So we try to involve family from the get-go. We involve them in family therapy to discuss safety planning, to discuss discharge options, to discuss supports that both the patient, you, and the family will need after you go home. The main purpose of being admitted to the hospital is to stabilize and to remedy the issues that cause someone to be in crisis, which may take 3 or 4 days, sometimes shorter, sometimes longer. But the important aspect is to stabilize the person to the point where they can go home and re-engage in their daily activities, go back to their jobs, take care of their children, take care of their spouses. We provide resources for patients when they leave the hospital. They will have an appointment with a medication prescriber as well as an individual therapist. Our mission is to help people live the healthiest lives possible. So with Intermountain, we not only treat the physical body, but we also treat their mental health as well.